Good morning, everyone. Good afternoon. Thank you for joining us today. My name is Marie-Claude Allard, and I'm the communication specialist for CANUE. I would like to start by acknowledging that the Université de Montréal, where I work, is located on non-treaty Aboriginal territory. The land on which Université de Montréal is situated has long served as a site of meeting and exchange among indigenous peoples. I wish to pay tribute to those who, since time immemorial, have been its traditional custodians. So before we start, I would like to remind you to turn off your camera and stay on mute during the webinar. If you have questions during the presentation, please put them in the chat. Speakers will answer them in the chat as we go along. Also, this presentation will be recorded and sent to all registered participants after the webinar. This is the first of 3 introductory webinars in a project funded by the Federation of Canadian Municipalities, FCM, a local leadership and climate adaptation project, LLCA. This project, which is a collaboration between CANUE and the Canadian Health Association for Sustainability and Equity, CHASE, is focused on providing resources to local stakeholders to help them integrate health and health equity considerations into local climate adaptation and resiliency plans. And now it's my pleasure to introduce you to our first speaker, Jeff Brook. Dr. Brook is the scientific director at CANUE and an associate professor at the Dalla Lana School of Public Health. He will start by discussing health risk of climate change, vulnerable populations, and connections to equity.
Thank you, Mary Claude. Just having to unmute myself here, and now I can see my presentation as well. I hope everybody can hear me clearly. Thanks for joining today. It's my pleasure to kick off this first webinar, and I'm going to just give a quick overview of a range of ways health and equity connect in climate change. Many of us may be aware of the series of journal articles and special issues from the Lancet, a very prestigious health journal worldwide, and the Countdown series that they've been doing related to this topic. They started even prior to 2015, but I think they started to publish special issues at that time. And one of the main things pointed out in the 2015 was the public health opportunity that climate change represents, the greatest public health opportunity for the 21st century, potentially. And that certainly has started to raise the profile all the way towards, there being health days in the current Conference of Parties meetings. As they went further into the series, they brought up another really important point, which was the opportunity to improve health, but also to reduce inequities, that there are many opportunities in that realm also to be thinking about. These are all key things that we can see in terms of avoiding impacts of health, building resiliency for the future, and improving public health along the way. If we just take a quick look at the climate change health connections, there are things you would put into the direct impact categories like extreme weather, where flooding is certainly the leading edge of extreme weather events that we experience in many places in Canada. But heat waves, wildfires, and other related disasters are all things that we directly observe and have acute short-term impacts and potentially long-term impacts. But there are many other indirect ways that climate change is connected to health, and they're very far-reaching. They could be ways they exacerbate air pollution issues, lead to food and water contamination, changing the distribution of vectors and Lyme disease, other diseases like that. And then even further along, ways in which food insecurity has impacts on health, climate change initiating conflict through resource scarcity, and mental disorders. It's a complex, far-reaching range of impacts from which we can think about health and climate change. Jumping into some of the key ones that are in front of mind, heat stress is a particular one of importance. And there is certainly sort of the heat strain effects that occur as we get into heat waves, and everybody potentially experiencing things like nausea, fatigue, headache, dizziness, and having challenge to keep themselves cool. Getting much more severe would be heat stroke and the impacts that heat stroke can have. and how these can certainly lead eventually to death. There's also clearly ways in which our system can prepare for this. And in the past, there's been observed increases in requirements for ambulance calls and other emergency management services, such as in Toronto in the past and Quebec in the past, that put extra strain on our healthcare systems. I think all of us are still remembering the 2021 heat dome out in British Columbia, probably an area where something of this magnitude was not initially really thought was the prime location for it. But looking back on this, it had major impacts in terms of the numbers of deaths, 619 recorded during this period. And a large number of them, two-thirds, were over 70 years of age, and even more than half were people who lived alone. Uh, and that's certainly, I think, a theme that we see often in this area. Many of them in this area don't have air conditioning, so that was part of an issue, or even access to fans, given that this was an area where heat is less common. But there were really a number of common factors, from the age to the pre-existing chronic conditions that people deal with, but also into socio-demographic factors like income and housing and social isolation. Very important to consider and keep in mind as we think about adaptation. And going forward, there are really a large number of vulnerable people, such as in the Greater Toronto area, where 500,000 people are living in older apartment blocks with multiple stories, where if we have combined heat and also loss of power, we're looking at a perfect storm of conditions. Just to recap some of the vulnerable groups with respect to heat, clearly age is a risk factor given their compromised ability for thermal regulation through cooling, sweating, so on. Their greater incidence of chronic diseases, dependence and use of medications, and potentially being socially isolated. But it does extend right down into the youth with respect to their inability to recognize what's happening to them as they may be experiencing heat stress and unable to remove themselves from situations. And there are also physiological areas where cooling is more challenged at that age, and they can even get warmer quicker. And that clearly now also extends to the unborn fetus and the pregnant mother as well, and what impacts that can have. So a lot of groups to keep an eye on. And mixed in with that would be a variety of social conditions, which can multiply the threats, whether they be low income or housing conditions that are all really important. Let's just switch quickly to look at flooding, another of the sort of big three that we experience in Canadian cities. Clearly, there's lots of ways that there's acute injuries and death, but the disruption that can happen with being cut off from services can extend for lengths of time. Floodwaters do also mix with other sources of contaminants that can lead to concerns with respect to bacteria or chemicals. And we also hear about the dampness that can come in structures that have been affected that can lead to more mold formation and then irritations, respiratory and immune system irritations. And not at all to be overlooked is the large impacts in the short and the long term on people's mental health. Here's a picture of something we might have observed ourselves, watching it in the news over in Spain. We're here, 50% of the deaths were people over 70 years of age. And it's really important to realize that these things events affect different people differently. Youth and children may experience disasters and have more lingering effects later in life. But communities such as in Abbotsford, BC, farming communities, have also issues to be thinking about. We now I turn to a more recent event here in Montreal, where this past summer, the second tropical storm of the year made it up into Ontario and had major impacts. Local states of emergency declared in 8 municipalities, 400 people evacuated, at least 260 homes flooded. And this reminds us again that rainfall is different than it used to be. This tropical storm, Debbie, moving up there, dropped 150 millimeters of rain in 2 days. And it's important to remember that every 1 degree C of warming from climate change means more water in the atmosphere. In Abbotsford, they were the recipient of lots of rain from an atmospheric river. And we are hearing more and more about these different terms as climate change takes hold. Atmospheric rivers, polar vortexes, and bomb cyclones are now becoming part of our vocabulary. And looking back on the Abbotsford flood, there was assessments looking at the amount of despair and shock that impacted the populations there, the trauma that was ongoing through this experience, and all the different ways that this can really get into people's mental health in the short term. But also many years later, such conditions can arise. As we start to think about that, we think about how long do we have to start to look to consider the impacts of events such as this. Hurricane Fiona is another example where this was more damage from the hurricane and not the flooding per se. But 86% of the people reported negative impacts on their mental health that were occurring after this. Large numbers that make us really wonder. These effects don't go away right away. And um, recently, this has been looked at. This is a long awaited question in my mind was how long do these effects last? And here looking at many hurricanes over a number of years in the United States, this group in Stanford found that while there were 24 immediate deaths sort of typically reported in an average tropical cyclone, the numbers afterwards lingering for 15 years and more far outweighed those numbers. A large fraction of health conditions continue beyond the individual event. And these are things we need to be prepared for as we go forward. Canada does have a national adaptation strategy that we hope to help support through our work at CANUE. Right in the front of the strategy is really dealing with the concerns around heat, rightly so, given the very large impacts heat can have on populations. And one of the other goals beyond eliminating by 2040 any deaths due to heat is to make sure that there are tools that people can use that bring in health impacts as we're thinking about adaptation plans going forward. We all know, being people that are urban dwellers and dealing with challenges in cities, that cities are truly on the front lines of dealing with climate change, whether it be mitigation, reducing their emissions, or adaptation. They both need to happen at the same time. Here we're to talk about how we can, while doing those to mitigation and adaptation, find ways to be thinking more carefully about who are the vulnerable populations. How can we address their short-term and long-term needs, and at the same time bring health benefits? There's lots to be gained. Maybe the $1 that's spent on adaptation that brings in 15 could be even much more if we really optimized our paths going forward. I'm going to turn it over now to Kim, who's going to talk more about the co-benefits that can be realized through moving ahead in mitigation and adaptation. Thank you.
Thank you, Jeff, for this great overview. Now I'm just going to present to you our next speaker, Kim Perota. Kim Perota has a master's degree in health science and over 30 years of experience promoting environmental and built environment policies that improve health and health equity. She is the executive director for Chase. And to you, Kim.
Thanks. Thanks, Marie-Claude. So Jeff provided an overview of the health risks presented by climate change. Now I'd like to flip that scenario and present in a very brief way the immediate health benefits that can be associated with local climate actions. So communities across the country are looking at the investments that are needed to fight climate change, to support the energy transition, and prepare for the climate changes that are now locked in. This presents a once-in-a-lifetime opportunity to both protect people in our communities from future climate-related risks and produce immediate health and health equity benefits for local residents. A number of studies have demonstrated that the policies and investments needed to reduce greenhouse gases can actually produce significant and fairly immediate health benefits for local populations. In fact, some of those studies have found that health-related benefits can partially and often and sometimes completely offset the costs associated with the implementation of those policies. In addition, the health frame can help win support from the public and local decision makers for climate policies and investments. In part, this because it's easier for people to appreciate the immediate and localized health benefits associated with climate actions than it is to grasp the long-term and global benefits that result from cutting greenhouse gases. I personally saw this in action in Ontario over 20 years ago, and then again in Alberta 10 years ago when we were working to phase out coal-fired power plants. It was the health benefits resulting from reduced levels of air pollution that won support for those policies in both cases. The power of the health frame has been demonstrated with several peer-reviewed studies. One in particular found that the public can be motivated to support climate solutions when presented with the health risks associated with climate change, the health benefits associated with climate action, and clear calls to action. And that same study found that when 3 points were combined, they can influence people across the political spectrum, which is something that can be very helpful given the polarized nature of climate change discussions these days. With many local climate actions, there will be health benefits for some members in our communities. However, if we want to reduce health inequities, that requires more intention. It requires understanding which populations face the greatest health risks and where they're located. For decades, it's been recognized by public health professionals that social environmental factors such as income, ethnicity, gender, immigration status, and housing have a significant impact on health. We call these the social determinants of health. In more recent years, it's been more clearly understood and articulated that these factors are shaped by the interpersonal and systemic biases within our society, such as racism, sexism, and colonialism. By prioritizing investments in neighborhoods that are home to these structurally disadvantaged populations, we can correct for social injustices, reduce health inequities, and have a greater impact on the overall health of residents in our communities. I'm going to provide a very high-level overview of the health and health equity benefits that can be associated with 4 local climate actions as examples. On a global scale, urban centers are responsible for 80% of energy-related greenhouse gases. Most of those emissions are related to the fuel used for transportation and the heating and cooling of buildings. Public transit is recognized by many organizations as one of the most effective climate actions that can be applied to the transportation sector. Investments in public transit can significantly reduce vehicle kilometers traveled, which in turn reduces greenhouse gases. By reducing vehicle kilometers traveled, public transit can also significantly reduce traffic-related air pollution, or TRAP for short, TRAP. TRAP is a very toxic air pollution that builds up around traffic corridors, particularly around high-volume traffic corridors. It has been clearly linked with a broad array of negative health impacts, including asthma, cardiovascular disease, lung cancer, and premature deaths. Health Canada estimates that TRAP's responsible for $9.5 billion per year in health-related impacts. A modeling study conducted in the GTA, the Greater Toronto Area, demonstrated that the air pollution health benefits from transit can be amplified substantially when transit vehicles are replaced with electric vehicles. Public transit also provides many other health and health equity benefits. It increases levels of physical activity because many trips begin and end with active modes of transportation. It increases access to jobs, essential services, and recreational opportunities for the many people in our communities who do not drive or cannot drive because of age, ability, or costs. It also reduced the cost of living by limiting the cost of owning and operating a car, which can average $6,000 to $13,000 per year in Canada. We can further reduce health inequities in our communities by improving service to low-income neighborhoods where people are more dependent on public transit for accessing their essential services. Walkable neighborhoods that situate homes or workplaces in close proximity to common amenities such as restaurants, grocery stores, transit services also provide significant climate benefits. Walkable neighborhoods are associated with fewer greenhouse gases because the people who live in them walk more frequently, use public transit more frequently, drive less often, and drive shorter distances. Hundreds of studies have been directed at the impact of walkable neighborhoods on health. Collectively, these studies have demonstrated that walkable neighborhoods increase levels of physical activity, lower levels of obesity, prediabetes, and hypertension, and reduce the rates of diabetes and premature deaths from cardiovascular disease, strokes, and all non-accidental causes. In addition, a few studies have found that walkable neighborhoods produce greater health benefits for low-income populations. We can probably reduce health inequities in our communities by increasing the walkability of less walkable neighborhoods that are home to those who live on lower incomes. Green buildings and building retrofits can greatly reduce greenhouse gases from the building sector in our cities. This is particularly true now that we have cold climate air source heat pumps that can operate at temperatures as low as negative 25 degrees. These heat pumps can supplement or completely replace conventional furnaces and air conditioning systems. They use 70% less energy and can cut home heating costs by 70%. A number of studies have demonstrated that green buildings and building retrofits can improve health by reducing acute and chronic health conditions that can result from extreme temperatures, dampness, mold, and indoor air pollution. Correct ventilation rates, efficient air filters, and insulation reduce mold and dampness, they improve air quality, and they minimize extreme temperatures and noise. When heat pumps are added to this picture, occupants can be protected from extreme heat as well. And by reducing energy costs, heat pumps can reduce energy poverty, allowing those who live on low incomes to spend more of their money on essentials such as food and housing. We can reduce health inequities by ensuring that green building standards are applied to affordable housing and that building retrofit programs are designed to meet the needs of populations that live on low incomes. Trees, parks, green space, and greenery can increase climate resiliency by reducing the risk of flooding and cooling the air. By doing so, they can protect people from the health risks associated with flooding, provide respite from overheated buildings, and cool the temperature of whole neighborhoods. But green space also produces immediate health benefits. Over the last decade, many studies have been directed at the mental and physical health benefits associated with green space. The evidence suggests that green space decreases stress and depression, improves cognitive function and birth outcomes, reduces obesity and diabetes, and significantly decreases premature deaths. A few studies have also suggested that the health benefits are greater for children and for those who live on lower incomes. We can reduce health inequities by prioritizing low-income neighborhoods that are less green for tree planting and green infrastructure. So this has been a very high-level summary, and there's probably a number of qualifiers and clarifications that are needed. So if you'd like to get a clear sense of the evidence, you can check out this report, Climate Change, Population Health, and Health Equity. That was I prepared this for Chase and the Canadian Public Health Association and the Ontario Public Health Association in 2023. Thanks.
Thank you, Kim. If possible, to share this link in the chat. And now, our final speaker, Danny Doiron. Dr. Doiron is the Managing Director of CANUE and Assistant Professor at Université de Montréal.
Thanks, Marie-Claude. So in my part of the presentation today, I'll give you an overview of the healthyplan.city tool that Jeff mentioned in his section of the webinar. So I'll begin by taking a minute here to give you a bit of background on the project. So Healthy Plan is an offshoot of the Canadian Urban Environmental Health Research Consortium, or CANUE, which is an academically funded initiative that was launched in 2016. And since it began, CANUE's main objective has been to develop a central data platform of standardized environmental exposures and built environment metrics to support environmental health research in Canada. So CANUE makes its data available free of charge to any university-affiliated researcher or student. And over the years, CANUE has become the go-to source for health-relevant environmental exposure data in Canada. So far, we've supported over 400 research projects that have led to more than 200 peer-reviewed publications and graduate student theses. Early on in our project, in the CANUE project, our team saw a real opportunity to leverage these nationally standardized data sets that we had assembled. And so with the support of the Public Health Agency of Canada, we launched the healthyplan.city platform in 2023 to allow individuals to map and visualize urban environmental exposures in Canadian cities. And with this project, we aim to make data assembled via CANUE available to individuals outside of academia, and thereby support local decision-making and advocacy, in addition to supporting research projects via CANUE. So as an overview, Healthy Plan is a free web-based tool that allows users to map 26 different demographic and environmental indicators in 129 cities across Canada. Within these municipalities, the tool allows users to explore block by block distribution of health relevant environmental factors such as air pollution, heat islands, and access to different community amenities. The tool also allows overlaying demographic and environmental indicators to show a picture of environmental inequity in Canadian cities. And finally, Healthy Plan allows users to compare environmental inequity across similar sized cities and across neighborhoods within a given city. The tool includes 13 environmental indicators in 4 domains, which include an urban climate domain, as you can see on this slide. And as with the data assembled in CANUE, all data in Healthy Plan are nationally consistent, meaning that the methods that are used to measure environmental factors are the same for all Canadian cities. Data included in our tool are derived from a variety of sources, including high-resolution satellite imagery and large open-source geospatial databases and statistical models. And finally, each city block in the 129 municipalities included in Healthy Plan are assigned a value for each of these built environment variables that you see on the right of this slide. So to allow users to conduct environmental equity analyses, we also include data on 13 vulnerable populations or equity deserving groups in the tool. And these demographic indicators are all derived from the 2021 Canadian Census and are listed on the bottom left of this slide. Again, each of these variables are assigned to each city block in the 129 cities included in the tool. And finally, we used Statistics Canada files to outline city boundaries and city blocks to which demographic and environmental data are assigned. So I'll give you a brief demo here of the healthyplan.city tool. So on this slide, you see the distribution of tree canopy cover for the City of Montreal. The data for tree canopy cover we present in the tool was derived from high-resolution satellite imagery, and we averaged it for all city blocks in each of the cities included in Healthy Plan. And as you can see in the legend on the upper left here, we show the average percentage of tree canopy cover within each city block, and red polygons show low tree canopy cover, while darker green indicates areas of denser vegetation. And as I'm showing here, clicking on a location provides tree canopy cover values for this area. We see that even within neighborhoods, there is considerable variations in vegetation or tree canopy cover percentage. We can also explore the distribution of demographic factors within each city included in the tool. So to do so, we first need to select none under the built environment drop-down menu, and we can then select the demographic or vulnerable population indicator from the third drop-down menu. Here I show the variation of low-income first-generation immigrants for the City of Montreal again. And these data are available for each city block and each city included in the healthyplan.city tool as they are for each environmental indicator. We can see here that by clicking on city block, we get the percentage of low-income first-generation immigrants living in this area. And as I mentioned earlier, all demographic data included in the tool were obtained from the 2021 Canadian Census. And while mapping these variables individually allows us to see spatial patterns in environmental and demographic indicators, one of the key features of the Healthy Plan.City tool is the ability for the user to overlay environmental and demographic indicators to obtain a picture of environmental inequity in Canadian cities. This is displayed in the tool using what we refer to as equity priority maps, like the ones that you see on the left here. So I'll take a moment here to explain how we derive these maps. As shown in the matrix on the right of the slide, we divide all built environment and vulnerable population indicators into above or below median values for each city. So on the y-axis of this matrix, we see vulnerable population ranks, and on the x-axis is favorable built environment scores. So we then intersect these data and highlight city blocks with above median percentage of vulnerable populations and below median environmental scores. The city blocks where these scores coincide are colored in yellow and red hues. Again, these are city blocks where there's both a higher proportion of vulnerable groups and lower than average beneficial environmental scores. On our maps, darker shades indicate higher priority areas or areas that are on the end of the distribution for both indicators. Here I show you how these equity maps are generated in the tool using two indicators we just looked at individually. So with the tree canopy cover layer selected, I select low-income first-generation immigrants, and this generates an equity priority map for this combination of factors in the city of Montreal. Again, the city blocks you see in yellow and red are the areas where higher percentage of low-income first-generation immigrants live in areas that are characterized by relatively low tree canopy cover. Here again, clicking on a city block gives you the value for a selected environmental and demographic indicator. And as you can see in the plot in the upper right corner here, we can quickly see how the value for both demographic and environmental indicator in a city block compares to all other city blocks in the selected municipality. Finally, this bar chart shows you how to compare, or allows you to compare rather, similar sized cities between themselves for the combination of factors.
I agree with all of the climate change mitigation and adaptation strategies. It is challenging, however, when our elected officials want to move to rip out bike lanes, renew interest in coal mining, discuss more pipeline development, to move fossil fuels across Canada, continue to build new communities beyond current boundaries, contributing to urban sprawl, etc. How do we better ensure a climate health in all policies approach at municipal, provincial, and federal level?
At this point in time, it is difficult. Looking at what we have here with our tool and the way that it can raise awareness at all levels within municipalities, can hopefully empower people to come back more forcefully in their requests for keeping climate and health on the political agenda, as it often gets displaced as other challenges are in front of us. So yeah, I think information to as many people as possible is a key first step, and that's what we hope to be able to do here. I'm open for other suggestions, though, Brent. It's a difficult one.
Yeah, thank you, Jeff. I think the next one would be for Danny. How often will data be updated to that change over time can be tracked?
Yeah, that's definitely a name of the project. We thought this by adding longitudinal data, so data over many years, this would be a very useful way for individuals working in public health or working in urban planning to look at, tracking how well an intervention works. This is not currently anything that we have in the pipeline for now, but definitely an objective of our project over the medium term.
Really, the census data, we know how often they're updated, and we have the most recent census in here now, and that will be an ongoing thing to be updating. But more long-term tracking, certainly to monitor positive change, is really important going forward.
So that's all the time we have. I would like to take this opportunity to thank everyone who joined us today's webinar. Your participation is greatly appreciated. We will offer 2 additional introductory webinars in May and June, one on extreme heat and one on floods. You can expect to hear from Canadian experts in these areas who will expand upon what Jeff and Kim covered earlier in today's webinar. Examples of additional applications of Healthy Plan for local climate adaptation will also be highlighted. In the meantime, please explore the Healthy Plan tool and send us feedback. And don't miss our next webinar, May 14th. It will be advertised in our newsletter and our LinkedIn page. If you're not yet registered to our mailing list or don't follow us on LinkedIn yet, please do so. In the fall, we will be running a series of webinars that focus on case studies where municipalities have actually implemented policies or projects that address both climate change and health inequities. So we hope to see you for all of our webinars in this series, and have a good day, everyone, and thank you.